all the drugs that you swallow, that are injected into you, or that get into your blood through your skin, will eventually get to your liver. And in your liver, they'll be changed in some way. And most of the drugs that you take are eventually removed from your body through your poop, that's your stool, or your urine. If you have kidney failure, we can do dialysis, which will filter your blood and do the work that the kidney is supposed to do for you. Unfortunately, we don't have an equivalent system to do what your liver would do for you if you have liver failure. So I'm going to talk about some drugs that can damage your liver and tell you how you can protect yourself. So let's look at pain relievers or painkillers. There are two common types of painkillers that can cause damage to your liver. The first is acetaminophen, which is sold commonly as Tylenol, and which is also called paracetamol, which is sold as Panadol. The difference in name just depends on the country that you're in. You can buy acetaminophen over the counter, and it's commonly used for pain and headaches, but it's also often included in a lot of cold, cough and flu remedies. This makes it really easy for you to take lots of acetaminophen without knowing it. Taking large doses of acetaminophen can cause damage to your liver, but not just that, taking it often can also cause damage to your liver. And if you're taking acetaminophen, you should try to make sure that you stay below 4,000 milligrams per day. So that means that you should always check any other drug that you're taking to make sure that you're not overdosing. Another pain reliever that can cause damage to your liver is diclofenac, which is often sold as Cataflam. Diclofenac is a prescription medication, but in many parts of the world, you can actually buy it over the counter without a prescription. Apart from the oral forms of diclofenac, you can also get it in the form of gels, creams and patches. And when you apply these to your skin, less of the diclofenac actually gets into your blood, so less of it gets to your liver. So these forms of diclofenac are less likely to cause damage to your liver. Other painkillers that can cause damage to your liver include aspirin, ibuprofen, that's Advil, and naproxen, sold as Aleve. The next group of medicines that can cause damage to your liver are antibiotics, which you take to treat infections. One antibiotic that commonly causes liver damage is the combination of amoxicillin and clavulanic acid, sometimes sold as Augmentin. And this is used to treat ear, nose and throat infections, chest infections and skin infections. Other antibiotics that can cause damage to your liver include flucloxacillin, erythromycin, azithromycin and isoniazid, which is used to treat tuberculosis. Another group of drugs that can cause damage to your liver are statins. Statins are used to treat high cholesterol, and so many people are taking statins nowadays. The kind of damage that you get to your liver from taking statins isn't usually very severe, but the degree of damage tends to increase with the dose. Signs of damage to your liver usually occur within 6 months of starting the statins or of increasing the dose of the statins that you're taking. The next medicine is allopurinol, used to bring down high uric acid levels that you might find in gout, with some kinds of kidney stones, and after taking cancer medication. Allopurinol is a well-known cause of liver damage, and the reaction usually manifests as an allergic reaction with fever and a rash. Another group of drugs that can cause damage to your liver are antipsychotics. Antipsychotics are drugs that are used to treat disorders like schizophrenia and other problems where you might have symptoms like seeing and hearing things that aren't real, disordered thinking, and it's also used in dementia. The risk of liver damage tends to be higher with drugs like chlorpromazine and olanzapine, and the risk is also higher if you're taking 2 or more antipsychotics at the same time. Another group of drugs that also work in the brain that can cause damage to your liver are antidepressants, and the rate at which antidepressants are being prescribed has increased dramatically over the last couple of years. Right now, about 1 in 10 people in the US is taking an antidepressant drug. And as more and more people are put on antidepressants, you're going to have problems, especially in the older population who are often already taking several drugs for different health conditions. Apart from depression, antidepressants are also used to treat panic attacks, obsessive compulsive disorders, anxiety, PTSD, that's post-traumatic stress disorder, and sometimes also for chronic pain like you have in diabetic nerve damage, in migraines, and in some people who have insomnia. Another group of drugs that can cause damage to your liver are some of the drugs that are used to have some kind of effect on your immune system. Azathioprine, sometimes sold as Imuran, is a drug that's used to suppress your immune system. It's used in autoimmune conditions where your immune system starts to see parts of your body as being foreign and begins to attack them. It's also used after transplant surgery to stop your body from rejecting the incoming organ. Another related drug is methotrexate. Methotrexate is used to slow down the growth of cells that divide fast. So that would include cancer cells, bone marrow cells, and skin cells. It's also used to treat psoriasis, rheumatoid arthritis, and juvenile arthritis. Apart from drugs, there are several supplements that are well known to cause damage to your liver. These include weight loss supplements that contain green tea extract, vitamins like niacin, taken at high doses for a long time, ginseng, black cohosh, which is often used to treat menopause symptoms, and some nutritional products like Hydroxycut, Slim Quick, and Herbalife. Liver damage from drugs can be divided into 2 different categories. You have the intrinsic reaction, where we know from studies that this drug, when people take it, it causes damage to the liver. Then you have the idiosyncratic reaction, where generally speaking, the drug doesn't cause any problems, but some individuals may just react to it out of the blue. So that means that you may take a drug that is okay for everybody else, nobody else is having any problems, but you react to that drug and you develop damage to your liver. Usually, damage to your liver from drugs can be reversed if you catch it early enough and if the damage isn't too severe. So that means that you need to know the signs of liver damage so that you can start to suspect that if you're taking a drug and you're having certain signs, you're seeing certain things, that it might be time to stop that drug with the help of your doctor. So some of these signs include abdominal pain, abdominal swelling, nausea, vomiting, yellow eyes, yellow skin, itching, and fever. Liver damage from drugs tends to occur more in certain people with certain characteristics. So when you look at age, liver damage from drugs is more likely to occur as you get older for several reasons. As you get older, your liver becomes less efficient at clearing drugs, so they build up in your blood and that high dose affects your liver. And as you get older, you're more likely to be taking several different drugs for long-standing health conditions and their complications. And all these drugs interacting together have a higher chance of affecting your liver. And then as you age, your liver actually gets smaller, it actually shrinks. So there's less liver to do the job. The next is alcohol. No matter what age you are, you should avoid alcohol as much as possible. First of all, alcohol damages your liver in itself, which makes your liver less efficient at clearing and removing drugs from your system. Another problem with alcohol is that it depletes glutathione. It reduces the amount of glutathione in your liver. Glutathione is like a super antioxidant which protects your liver from all sorts of insults. Also, if you're female, you have a higher chance of developing problems with your liver after taking drugs. If you're malnourished or you're fasting, then your liver may not be getting all the nutrients, the protein, the fats, the antioxidants, the vitamins that it needs to stay healthy. So when you add drugs to the mix, then you're more likely to have damage to your liver from taking those drugs. And you can watch this next video to find out about non-alcoholic fatty liver disease and how to reverse it.